First and foremost, let me reassure you that there's nothing scary about IVF. Research shows that patients having infertility treatment are often stressed out and there are a lot of confusion surrounding IVF and ICSI. Patients often worry about, is it painful? How long I have to take rest? Do I need to take leave? How much is it going to cost me? And what is going to be the success? Hi, I'm Dr. Anita, IVF specialist and laparoscopic surgeon from Cochin, Kerala. Our state, Kerala, is also called as the God's own country as it is a favorite tourist destination in India. After completing my gynecology training in England, I had the privilege of getting IVF and laparoscopic training from some of the best centers in London. And I'm extremely happy that I can offer my services to the infertile couple in India and abroad, especially to the rural India. IVF is a very simple and easy, straightforward procedure. It's all done in 2 to 3 weeks. So, what are the steps of IVF? After preparation and investigations, the treatment starts with injections on the second or third day of the cycle. The injections, they're painless. It can be taken by the patient at home by themselves, and they're just like insulin injections. After taking injections, you'll be having a couple of scans to monitor the growth of follicles which have the eggs. Once the eggs are ready, which is usually around 10 to 12 days, the procedure called egg pickup is done. This is where the eggs are collected and given to the embryologist in the lab. This procedure is done under either anesthesia or under sedation, and this is also painless. So, the only day that you have to take time off from your work is on the day of egg pickup, and you can go home after your egg pickup. So, on the day of IVF egg pickup, the eggs are given to the embryologist who will either do IVF by mixing healthy sperms to the eggs, or she will be doing the ICSI procedure in which a healthy sperm is directly injected into the egg. So the resulting embryos are usually grown in the incubators. The embryo transfer, which is the next step, is the most important step. This can be done either on second day, third day, fourth day, fifth day, or even up to the sixth day. The selected number of healthy embryos are directly transferred inside the uterus by the gynecologist under sedation. This is also not painful. And if you have excess embryos, those embryos will be frozen in liquid nitrogen containers for future use. And those embryos can be kept for a long time, even up to 2 to 5 to 10 years. And you can use those embryos even to have a second child. Pregnancy test is done after 2 weeks of embryo transfer, and the success is totally dependent on the quality of gametes, which is again dependent on the age and personal health. It is worth taking time to prepare the body for IVF because it will improve the success rate. You can have a good diet, do regular exercise, manage your stress, and have some vitamin supplements. A detailed counseling to mitigate the stress and a friendly approach will make your IVF a smooth ride, and you can even enjoy a holiday trip to Kerala. I know that you're worried about the affordability and the cost. The fact is that the cost of IVF in India is only less than 1/10 the price of IVF in Western countries. At the same time, we use the same equipments, media, methods, injectables, etc. And when you actually compare between IUI procedures and other infertility treatments, you can see that actually if you have those treatments for around 10 months, it will be the same cost as IVF. But if you look at the success of IUI, it's only 10 to 20%, and IVF is around 60 to 80%, depending on the age. So it's worth doing an early IVF rather than continuing unnecessary treatments for years and years together, because the success of IVF is actually going to go down over the years. IVF is all about teamwork, and I'm so glad that we have an excellent team here. We individualize the treatment of each patient and discuss in detail about each patient's treatment. And we also have an in-house embryologist who maintains the lab in perfect condition. If you have any doubts regarding either infertility, IVF or ICSI, please do contact us. You can contact us by either email or we can do online consultation.